Welcome to the Healthy Work Campaign's first live webinar. We're really pleased to present this webinar. It's called Using the Healthy Work Survey for Organizations. We have gone through a couple of name changes, but essentially you're here to learn about why using the Healthy Work Survey can be a first step in reducing chronic workplace stressors. We're going to talk about what those are and how they may be addressed and attended to in your organization. So as you can probably see, we are recording this video. So feel free to have your video on or off as you wish. Just in terms of Zoom dynamics, it would be helpful if while you're not asking questions or speaking to have your video off and muted, just because we're going to have quite a big group today. So my name is Marnie Dobson. I'm the director of the Healthy Work Campaign, along with my colleague Peter Schnall, who unfortunately can't join us today. He's traveling to Bogota, Colombia. I am also an adjunct assistant professor at the Center for Occupational Environmental Health, now in this program in public health at the University of California, Irvine. And I'm also the associate director of the Center for Social Epidemiology. And I'll let my colleague Paran, who is presenting as well, introduce herself. Paran?
Good morning, everybody. Good afternoon for those of you who are in East Coast. I'm Puran Fagri. I'm an adjunct professor in the Department of Environmental Health Sciences at the University of California, Los Angeles School of Public Health, professor emeritus at the University of Connecticut, recently joined the University of California, as well as being involved with the Healthy Work campaign. And I hope you have a good webinar today, as we are talking about work stress and how to implement our Healthy Work Survey for addressing work stress at your organization.
Great, thank you, Paran. So first of all, you're probably wondering, what is the Healthy Work Campaign? I know some folks on the audience list are familiar with the campaign. We have been presenting information about it since we launched the Healthy Work Campaign in 2018. It is a public health campaign to raise awareness in the United States, but also more broadly, we have a lot of colleagues now in Latin America interested in what we're doing. But we're focused on the health impacts of work stress on working people, and also on positive actions individuals and organizations can take to advance healthy work. So as well as talking about the Healthy Work Survey as a way of identifying work stressors, we're also going to take some time, Paran, is to talk about solutions to the problems of work stress. So the Healthy Work Campaign and the Healthy Work Survey are a collaborative project between the Center for Social Epidemiology, which is a nonprofit organization and the sponsor of the Healthy Work Campaign and the Healthy Work Survey. The center was developed by Dr. Peter Schnall and is a collection of researchers who have been working on work organization and work stress and health research for his organization began in 1988. I began working with him in 2005, along with Paul Landsbergis and others. So we launched the Healthy Work Campaign in 2018, as I mentioned, with our website, which is on the slide, www.healthywork.org. We have a big team of folks that are collaborating with us. Here's a list including folks in Latin America. As I've said, as one of our goals is to increase the Spanish language content on the Healthy Work Campaign's website. We also have a growing list of partners, and if you're interested in partnering with us, there's a website link right there. And we are also an affiliate of the NIOSH Total Worker Health Program. So then you've heard a little bit about us. Now I'd like to ask you guys to tell me a little bit about the role, your role in your organization. So we're going to do a quick poll. Forgive me as I do this, as this is the first time I've been running these polls, but they're kind of neat. So I'm going to launch the question, and maybe you can take a couple of minutes. It should show up on your screen, and you can select one of these options, and then we can share the results and see who's joined us today. Okay, just a few more folks. If you are running an older version of Zoom, sometimes it won't let you participate. But looks like we have about 84% participation, which is great. So let's end the poll and I can share the results. We have about 24% of people from health and safety. It looks like we have a few from human resources or wellness programs. We have 9% who are employers or managers, and about another quarter that are from research institutions, and some students, and let's see, some working people. Of course, we are all working people, so we all know the impact of work stress on our lives. So we'll learn a bit more about that today. Thank you for participating. The next poll I'm going to ask you is about how concerned you are about job stress in your organization, and it's on a scale of 1 to 5. So let's see how we're doing in terms of job stress. Okay, so let's share these results. It looks like a majority of people, here we go, it looks like about 48%, so almost half are either very concerned or extremely concerned about job stress. Now, of course, we know that many organizations have significant work stressors in the United States. Of course, COVID-19 has also made that even more the case. And your concerns are legitimate, and we're going to be talking about how to address these issues as we go through today, and we hope we can offer some tools and start to address some concerns and provide resources that will help people learn how to address work stress in their organizations. So we have a nice big group today, and I would like to just suggest that if you have, and I want to give everyone a chance to answer the questions, if you have questions as we go along on our presentations, please put them in, write them up in the chat box. My colleague Maria hopefully will be in the room, but we will collect those questions up and we'll have a question and answer time at the end where we can answer those questions and discuss them. Okay, so first I'm going to present about why we need tools like the Healthy Work Survey. The toll work stress takes on us as individuals and organizations. We'll talk about what the survey looks like and how to use it. And then in the second half of the presentation, Paran will discuss in some detail how to plan interventions at the workplace to prevent or reduce those work stresses and improve the quality of jobs and the health of employees or workers. So without further ado, the question is, why use the Healthy Work Survey? We know that from a lot of surveys that are annual, the American Psychological Association Stress in America survey, we have at least 30%, or 1 out of 3 Americans, say they typically feel tense or stressed out during the workday. Those working 11 plus hours per day, so working long work hours, are 2 to 3 times more likely to experience depression. And as you may know, depression is the leading cause of disability worldwide. Stress accounts for about 40% of sickness absence. It's at an estimated cost of around $228 per employee per year. This was estimated by the EU OSHA in a report in 2014. I really recommend you getting hold of that. I think the link is below. Scientific consensus was reached in the Tokyo Declaration where occupational cardiologists and occupational health epidemiologists all agreed that around 10 to 20% of all causes of cardiovascular disease deaths among working age people are due in some respects to work. And so unfortunately, about 1 in 5 Americans say they never engage in an activity to help manage their stress. So we know that there are a lot of programs in place to provide people access to stress management techniques, to meditation, some great programs. Unfortunately, we know that participation in some of these individually focused programs are somewhat limited. People are sometimes required to do these activities on their own time. If they're working a lot, they probably may choose to be at home with their families or commute and so forth. We believe that providing access to stress management and other techniques are very valuable for individual employees in managing their stress. What we want to add to this picture is the importance of looking at the environment in order to prevent that stress in the first place. We're going to talk about how that can be done and is being done. And the important thing is to remember that even while offering people ways to address the symptoms of stress, if they're walking into chronic work stress environments day after day, we spend most of our waking lives at work, it's not going to really do the job. So I'm going to do a little quick stress 101. Most of us may know about the fight or flight response and the biological stress response. You'll hear me talk about stressors a lot, and the full picture of stress is that it's biological, psychological, and social. So in the bad old days when we were hunter-gatherers and we were, often fending for our lives against actual real threats from wild animals or other physical environmental problems, those were the major stressors that provoked the fight or flight response. We have the same biological response. Our blood pressure, our heart rate increases, muscles tense, we have shortness of breath, and so on. Today, a lot of those stressors are more symbolic. They come from the work environment, they come from other environments, social environments, but they're still perceived as hazards and threats, and so they provoke the same kind of biological stress response. Now, of course, in the past, we had time to recover if we survived the threat from running or fighting, and our stress response returned to normal. In our modern industrial society, we walk into some areas where there's a lot of stressors day after day, and the effects of long-term exposure to chronic stress, where you don't recover, can lead to both short-term and long-term health effects. So things for headaches, sleep disorders, exhaustion have been linked in the research to stress, also musculoskeletal problems, mental health problems. We know we're suffering from a mental health crisis. Stress contributes highly to mental health, as well as to higher blood pressure and cardiovascular disease. So when I talk about stressors and this social aspect of stress, at work particularly, we are talking about sources of stress at work. They're sometimes referred to as psychosocial stressors. They're psychological and social. Some of the most well-known that have been studied in over 30 years of research are job strain and effort-reward imbalance. You can see on the left a combination of really highly demanding work, but having little control over the pace of that work, over the timing of the tasks, and over being able to have enough resources to actually complete the work is known as job strain, and it is being linked to heart disease mortality, to higher blood pressure, to depression, and so on. Effort-reward imbalance is another model that's been looked at extensively since at least the 1990s. Johannes Segres talked about the impact of high efforts at work, so including things like workload, time pressures, overtime, interruptions, conflicting demands, accompanied by an imbalance in rewards. So not just inadequate salaries, but it also may be a lack of esteem or support from colleagues or management. And we talk about a lack of social support, which can be a significant stressor and impact people's health. Work-life imbalance is a major stressor in the sense of how our work life can spill over into our family life and cause conflict, which can cause stress, which has had an impact on people's mental health and well-being. Bullying and harassment, unfortunately, in the United States, workplace bullying has reached somewhat epidemic proportions. The Workplace Bullying Institute does an annual survey, and even through the pandemic, around 27% of people experienced bullying, which is significantly related to staff turnover, as well as health problems for individuals who experience that at work. Long work hours, we know, as well as irregular schedules and hours, are also major stressors that have been linked to ongoing chronic disease problems. So what are the costs of this work stress? Two economists, Jeffrey Pfeffer and Joel Go, modeled 10 major work stressors and were able to estimate that the major work stresses that I've mentioned, workload, job insecurity, shift work, lack of fairness at work, and so on, actually lead to over 120,000 deaths per year. Now, we believe that's quite conservative. They also were able to predict that it related to about 5 to 8% of annual healthcare costs. It's about $180 billion related to these 10 major work stressors that they modeled. One of their references is below, but Jeffrey Pfeffer has published a book called Dying for a Paycheck, which I really highly recommend. He does a great job of laying out the costs of major work stressors on the health of workers. So work stress is a significant economic and social burden. To individuals, it impacts health and longevity. It impacts the quality of life of families and children and communities. To organizations and society, we know that it increases healthcare costs because of the impact of the chronic disease burden that is contributed to by work stress. It impacts and increases disability and workers' compensation costs. And there's a lot of research showing its impact on productivity, including increased sick leave, absenteeism, and turnover. So these costs are barriers to creating greater innovation, engagement, sustainability, and healthy organizations and healthy people. So we're really saying that it's important to address psychosocial risks. The United States is one of the only countries in the among high-income countries that don't address psychosocial risk factors or psychosocial risk management as part of occupational health and safety. So what is the Healthy Work Survey? It is a free online tool for individuals and organizations. We developed it as part of the Healthy Work campaign, the sponsor by the Center for Social Epidemiology. It identifies these sources of stress at work or psychosocial hazards, as I mentioned. It's scientifically validated. We're in the process of publishing a validation paper and background to the development of the survey. It was developed in collaboration with university researchers, myself and others, Dr. Bongkyu Choi, Paran Fagri, Peter Schnell, Paul Landsbergis, and others, experts from occupational safety and health, as well as working people. The majority of questions come from the NIOSH Quality of Work Life Survey and the General Social Survey, which is a national survey of the U.S. working population. Many of you are probably familiar with. It's administered every 4 years. And we used questions from this because we wanted to be able to compare the scores for an individual or for an organization to these national averages from the Quality of Work Life Survey. We worked very hard to try to keep it short. It takes about 15 to 20 minutes to complete online. It is anonymous. We do not collect any personal identifiers. It's secure and confidential. The key to this is that we offer a free automated and anonymous report. There is one for individuals that they can elect to receive via email if they choose. And for an organization, a group level report is provided within 1 to 2 days of having their participants complete the survey. It's emailed to the organization, and like I said, you can compare your stress scores on the major stressors to the nationally representative Quality of Work Life Survey of U.S. workers. So these are some of the elements that the survey measures. Like I mentioned, the major stresses, demands, control, support, rewards, so issues like respect at work, job security, fair earnings. We measure work-life balance, safety climate. We also measure some ongoing or emerging stresses, including issues related to workplace injustice, including workplace bullying. We do have some measures of the physical environment of safety, and we have a voluntary section on the impact of COVID-19. We also include a number of questions that can also be compared to US national averages, the CDC self-reported health questions, as well as questions on exhaustion, a key component of burnout, on sleep, on back pain, missed work days, and so on. So what are the next steps if you as an organization are interested in addressing work stress and identifying work stressors in your organization? So organizations can request access by filling out a short form on our website, and the links are below. There is a link for employers and businesses and for unions and worker health and safety advocates. However, the content is the same no matter what, whether you're an individual or a business. The Healthy Work Survey has the same content. We also, along with the emailing a unique link to the organization when ready, provide guidance about how to recruit at least 50 to 60% of employees. So in order to get a good, valid result in your findings, we do recommend that at least 50%, hopefully up to 80% of those invited participate. So this is an example of the group report. This is the first page. It's a cover page. It tells you the major risk factors in each of these areas. So for this is just an example organization. It's not based on a real organization. But in this organization, you can see that around 39% of the group are at high risk for high job demands, 48% for high workload, and 47% for low job control. So we break it down for people so it's pretty easy to digest, but then we also give everybody sorry, I need to click here, a table with the results where you can actually see some of the numbers showing your group's average compared to the US average. We're able to automatically determine whether that group average fits into the high risk level based on US population tertile scores, high risk, intermediate risk, or low risk. And in addition, we also tell you the percentage of people within the organization that fall into that high risk category. There's a red flag put next to those issues that are of most concern, and this should help your organization to prioritize what the major work stress issues are and should be attended to. This is the page where we present results on the impact of COVID-19 at work. We have some important questions about whether employees know about the infection control program. In this instance, there were almost 36% that didn't know their employer had an infection control program. So this could tell you that you need to do more work on communicating around health and safety, and so on. This page of the report is one of the pages on self-reported health. It breaks down these general social survey CDC questions on self-reported health and allows a comparison for those in your group, the percentage of people exposed to poor physical health, for example, for 14 or more days, compared to the US population that is grouped together in a series of 4 waves of from 2002 to 2018. So the good news is work stress can be prevented, and we're going to talk more about how to take these results and findings from the Healthy Work Survey and begin to plan and create a process in your organization to create interventions, programs, or policies that could address some of these priorities. And my colleague Participatory Approach is going to talk more about that in a moment. What I want to impress upon you is that in this classic, stress interventions triangle, we know that allowing individuals some kind of coping mechanisms or resources to help with the symptoms of stress are important. However, the most effective, based on the research, is the prevention or reduction of the stressor at level 1 or level 2. Ideally, in your organization, we need to do both. Looking at how work can be redesigned to improve the quality of work and reduce work stressors, while at the same time offering individuals ways to ease their stress-related symptoms. So I'm going to let Puran take over now and share her slides. And please feel free to put questions in the chat box. We'll collect them up and we can have a discussion as we finish Puran's section of the presentation. Puran?
All right, okay, let me just get here. Okay, do you see my screen?
Nope.
Well, let's try again. Is it working?
Yep, there we go.
All right, perfect, thank you. Well, thank you everyone. Sorry for the delay. What I would like to do at this point to continue the session by talking about intervention strategies that could be implemented at the workplace to reduce stressful working conditions, improve employees' health, productivity, and performance. We all agree that stress could not completely eliminated without addressing the working conditions, work environment, and organizational culture. So in this part, I'm going to focus on participatory interventions to reduce stressful working conditions and integrating helpful changes into work environment and organizational culture. So when planning an intervention, there are several key features that you need to consider. The first is that the intervention should have a clear goals and objectives and follow a systematic and stepwise approach. You need to understand what is it that you're trying to change in order to plan an intervention appropriately related to what you're trying to achieve. Intervention should be done following a risk factor and identification of the vulnerable groups. It is very important to understand that each organization is different based on their size, based on their sector, and based on the culture. And therefore, risks and stress associated with your organization is different from each other. It is not possible to take an intervention that worked, for example, for company A and try to mimic it in your organization. It is better to perform this risk assessment. And therefore, we say the intervention should be tailored to your organization culture and size. The intervention should be adaptable, flexible, accessible, and user-friendly. So basically, it says that intervention is not set in the stone. If you realize that you do something but you have lack of engagement or lack of participation from the employee, you need to change your approach. Also, you want to make sure that whatever you are doing is accessible and user-friendly to all of the employees of your organization. The intervention should target both the individual and organization, And it also should educate and provide training for the management and organizational leadership to increase and improve their capacity and skills in understanding stressful factors in your organization and how to address that. So what is the participatory intervention models? These models broadly have been advocated as an effective strategy to improve occupational health that benefited both the individual and organizations. The approach basically encouraged the involvement of all stakeholders in the intervention design and implementation efforts, and typically use theory, research, and practice to do so. So the main goals of the participatory interventions are to first to address the root causes of the issue related to work safety and health and well-being in your organization, to increase communication and collaborations at all levels of your organization, and to develop a business case that is acceptable by both management and the workers alike, to implement solutions that are effective and accepted and sustainable. Sustainability is very important. Unfortunately, many intervention usually has been cut short as soon as some changes in the organization happen. So when you do participatory intervention, because you're getting to the root causes of issue and you're trying to integrate in your organization policies, strategies, hopefully it is more sustainable. It also integrated into organization culture, which increased success rate and program sustainability. Typically, the main purpose of the participatory intervention is that it takes into account workers' first-hand knowledge about their job, including the sources of stress, variance in job demand, job control, and job constraints. So workers are the people who know the best what is it in their work that is stressful. So what is the benefit to the organization? We have shown and we have studies that shows when employees are involved in planning the intervention, it provides a sense of ownership for their work, and therefore it creates a safer, healthier, and more productive employees. It also increases morale and job satisfaction, so eventually increase productivity. It increases workers' autonomy, improve health-related decision-making, decrease injuries and accidents, decrease work-related stress. And finally, studies have shown that these type of intervention in a long term reduce the burden of chronic disease, which are the leading cause of death in the United States, as well as the highest healthcare expenditure for the organization. And as Dr. Dobson mentioned, and many studies have shown, stress could be causing many of the chronic disease, cardiovascular, musculoskeletal, and so on. So it has major benefit to the organizations. Now, the question is, how do we go about designing an participatory intervention? As I mentioned, the most important aspect of participatory intervention is to understand employees' need, aspiration, and issues that are affecting their health and productivity. So this is typically referred to as need assessment. This could be done by using surveys such as our Healthy Work survey that Dr. Dobson just talked about. It could be done also based on the size of your organization by focus groups or interviews. You need to understand what are the organizational and work-related issues are before offering a tailored intervention, realizing that there is no one-size-fits-all, and therefore each organization is different. Secondly, you need to know what are the existing programs and policies in your organizations are, both as the promoter and deterrent of employees' health. So if something already is in existence, if there is a policy or if there is a program that is already working in your organization and you're happy with, why don't you just continue and try improve upon it rather than starting from all over? Also, it is important to understand what resources are available to you before you're starting an intervention. So, if you do not have much resources, and resources are based on personnel, financial, and policy. So if the resources are not great, you may not be able to start a very huge full-blown program, and you may want to start from low-hanging fruit and eventually build upon what you're doing. So the point is that you never give up. You start to do something at least in your organization. You want to propose intervention based on scope and impact, resources and costs, benefits and effectiveness, and obstacles and barriers. Basically, this means that whatever you're proposing, you want to make sure that it affects the majority of your employees. It impacts a larger group of your employees. You want to make sure that the program is basically at the same level of the resources that you have available, and you have to do a cost benefit analysis. Sometimes you may do the cost benefit analysis in a long term. For example, studies have shown when you reduce the work stress, there is higher rate of productivity, less on the absenteeism, lower in presenteeism, what we call, and therefore in a long term is effective for your program or for your organization. Also, you want to pay attention to the obstacles and barriers in your organizations. You want to invite people with expertise and experience in your intervention team. Sometimes organizations have people who have great experience dealing with some of the issues. Why not starting with those people and invite them rather than going to outside resources? But the most important thing is that people who are going to be in your participatory team should avoid biases. They're not there to solve their own problem, but rather the organization problem. Also, you want to make sure that your decisions are supported by the majority. And finally, communication. Communication is the key to successful program implementation. Both the employee and management must receive communications regarding the implementation process and phases of your implementation. Clear and transparent communication increase employees' commitments and engagement into the program. Moving on, I'm going to talk about what are the intervention phases in participatory intervention. Generally speaking, there are several steps that you need to understand and do when you're doing an intervention in your organization. The first step is preparation. Basically, at this stage, you want to increase awareness about the work stress. You want to start talking in your organization about work stress. Have employees talk about it. You may want to say, what is your ideal workplace? And as individuals start talking, you can make a note of what are the issues that are actually bothering them. From there, you develop your risk assessment. And based on this risk assessment, then you can tailor your action plan which target a specific stressor and hindrances to healthy work at your organization. You then move on with your action planning. Okay, you find out what are the stressors are, how you're going to go about acting upon it. And remember, during this stage, your participatory group need to think about choosing an intervention that is going to impact a larger group of employees, and also think about what they have, resources they have at their dispense. So if resources are limited, they may have to rethink about their intervention. The implementation phase, usually during this time, you have to have some idea as to, in a larger scale, what you're trying to achieve. And sometimes we say, maybe you should have it in a kind of theory based on the job demand resource model. You want to reduce the demand and you want to increase resources in your organization. Finally, evaluation. More and more organizations are interested to know, okay, so what we have achieved. So having an evaluation plan is very important, and having any specific objectives are very important. Sometimes we refer to these objectives as SMART objectives. SMART is basically specific, measurable, attainable, reliable, and timely. You want to make sure that whatever change you are planning to do, you can actually measure it. You want to make sure that the changes that you are trying to see is related to your intervention, and also want to make sure that the allocation of the time for the change to happen is appropriate. So you are not going to go about and trying to measure the change when really you didn't have enough time for the change to happen. And that would help you for a successful program and actually selling it to your management in the organization. Here, I'm going to provide an example of the participatory approach, but by one of the National NIOSH National Centers of Excellence, Center for Promotion of Health in New England Workplace. I was one of the investigators in this center, and I was actually involved with developing this tool and using it for many of my own interventions at the workplace. IDEAS stands for Intervention Design and Scorecards, and the tool is based on communication and collaboration between the two committees. We have the management committee or a steering committee, and they basically allocate and coordinate the resources, they consider interventions, they make strategic decisions about the plan, and also help promoting it at the workplace. We have the design team, which is basically there are frontline workers, and they help identify root causes of the stress or hazard at the work. They design the concept for the intervention. They develop a business case to propose it to the management, and then they select what issues they want to tackle. This is very important because the design team actually people who are going to be in your design team need to be people who are committed, who are enthusiasm, and also very good listeners and learners, because the process may take weeks and months. And so it's not something, the continuity of the people who are participating in the design team is important. Now, the main component of this IDEAS tool is the continuous communication and feedback between the steering committee and the design team. And sometimes you may want to have a facilitator who's the unbiased person who actually helps with the dialogue between the two committees. Here, I provide you with the representative graph of how the dynamic between the two committee works. Typically, the IDEAS tools has 7 steps. In the middle part, the green part, is the activities of the design team. And the blue part are the activities of the steering committee. So as you can see, at each of the steps, each committee have activities to do. Therefore, commitment from the management and the design team are very important. So in step 1, for example, the design team start to talk about the issues related at work, to conduct the root cause analysis. They would then brainstorm and try to find a solution to the problem. And from then, they think about intervention. They may think about many interventions. However, they select their criteria as to what intervention they're planning to choose based on the scope and impact, as well as resources that are available to them and effectiveness. They would then propose this to their steering committee, and a steering committee have choice of looking at the business case, provide impact to the design team, and from then the design team can rework their intervention, go back to the steering committee, and finally they implement the intervention. Here, I actually provide you one of the examples of what we have done in one of the workplaces. Actually, it goes along with the example that Dr. Dobson showed you from one of the organizations that have high demand, low resources, and higher long work hours, which eventually would end up to be leading to burnout. So burnout is basically emotional and physical exhaustion that lead to job dissatisfaction, loss of personal happiness. It may cause depersonalization, depression, and reduce personal accomplishment. So in this organization, the root causes that the design team identified was this issue. And then they went about and identified 3 major sub-issues that basically contribute to workout in their organization. They said we have unclear job expectations, we have long working hours, and we have lack of social support. For each of these issues, they identified contributing factors. For example, they said for unclear job expectation, we have lack of communication between employee and management. We have poorly defined roles. We do not know exactly what we're supposed to do. We also have conflicting roles. Some of us, we have to report to two managers, and we don't know which one to prioritize, and this would end up to having staying long for the work and having a burnout. For long working hours, the contributing factor, they said that we have too many meetings during the day, which take away from the actual work time, and in order to complete the task, we have to stay longer. They also said the management have unrealistic goals, and therefore we are not able to complete the task by the end of the day. And some also talk about work-life family conflicts because they have small children or they have family responsibilities that take away from the work, and they have to work during the weekdays or weekends and long hours. For lack of social support, they said the contributing factors is we have dysfunctional work dynamics in this organization. There is not much communication between management and employees. We have lack of teamwork, and also we work in isolation, so there is not much communications. So as you can see here, the design team went about and actually provide 4 or 5 interventions. But based on the idea of the scope, impact, and resources, they said, okay, let's start increasing communication in our organization as a first point. And as a specific objectives, we want to see how often management meet with the employees and the number of emails or notes that management communicate about their expectation with each employees. And as intervention, and they offer 3 alternatives. One is to train the management to improve their communication skills. 2 was to provide training for employees to express their needs and communicate to the management. Also, they talk about redesigning some of the workstations so there is more face-to-face time with the manager so they can talk to them more often. And also said that training for the employees to express their needs. And some said maybe having a suggestion box because we can put our issues of concern in that box and management can read it and be aware of it. So as you can see, there are many ways to address work stress. Participatory interventions, based on my own experience as a researcher in this area for the past 25 years, is the best way to address work stress rather than top down or bottom up. There is a need for collaboration and communication between the employees and management in a very peaceful manner, with an understanding that they both working towards a better work organization, work culture, and what we call healthy work. So if you are basically concerned about your organization and you want more information, as Dr. Dobson said, in our Healthy Work organization, we have informational pages that you can go and find out about how to go about to do intervention and identify stressors using our survey. We also provide you with the real world examples of what other organizations have done in order to address some of these stressors. For example, work-family imbalance, reducing bullying, job control, sexual harassment, or labor management issues. So I am going to stop at this point, and I'm going to give the podium to Dr. Dobson, which is going to continue with our poll. And after that, we would like to open for question and answers, and we really want to hear from you and how we can help you with some of the questions that you may have. Thank you.
Thank you, Paran, for that really excellent detailed presentation. We are going to make the webinar itself available for people to view on our website, as well as a PDF of our slides. So hopefully that will help you. We are making all of these resources free on our website, and we are here to help all organizations. I think before we ask the questions on the poll, I'd like to answer the questions that came up in the chat box. make sure people get their questions answered. I'm going to quickly bring up the chat box, which has now disappeared on me. Okay, there it is. Okay, so I did write down some of the questions. Amy Grover had a question early on. She asked, do you break down the responses by department? For example, they have an orthopedic group, and she was saying that there may be differences between the office workers and those that are the nurses, for example. The Healthy Work Survey does ask about occupational category. So we can actually provide a report for office workers versus healthcare staff in that case. And we can probably, get a sense by just looking at the numbers to see if there are major differences, which there may be, and then you can create policy or interventions specific to that department. There are some limitations on how deep we can dig down on occupation. If, for example, you have a single occupation corporation, that might be more difficult to do. Hopefully in the future, we'll have more flexibility to break it down by department. We can also run the survey by department. So you could get, if you have 4 major departments, you could get 4 links. We could provide 4 reports based on those departments. So that's another way that it could be done. Lena Morales asked, is the tool available in other languages? We really would like it to be. We're working hard. Hopefully, in the future, we would like to translate it into Spanish. We have our Spanish language development experts, some of them online with us today. We know it's a big undertaking to translate a survey and provide validation for that Spanish language survey. So that is a high priority for us. Unfortunately, it's not available at this time in Spanish or other languages. However, we are working on and do have a tool on our website to translate all of our pages into any language that you choose at this point. We have a question from Ashley. She asks about the timeline in which employees have to complete the survey. She said they have 800 employees on many different shifts, and they have intermittent access to computers. It can take 2 to 3 weeks. It can take a week, depending on how many employees you have. It can take a month. It's really up to the organization to decide, how long that takes. We're really here to guide you in that process. We have educational materials that can be provided to employees to talk about, why the Healthy Work Survey might be helpful, how it might help them, how it might help the organization, which we can also provide to encourage participation.
If I may interject, Marnie, another important issue related to starting a Healthy Work Survey is to communicate with your employees in advance and to increase their awareness and the importance of the issue. This way, you basically increase alarm about the issues, and the participation would definitely increase rather than just initiating without any advance notice. Sorry.
Yes, absolutely. And we've had that experience with companies as well, where if we are able to discuss it with more levels of the organization and obviously have more buy-in from all levels of the organization, then the participation rates, especially if employees are involved in the process, are much higher. Leslie did respond about breaking down the survey by department. And she brings up a really good point in the chat box, thanks Leslie, about breaking down the survey when there are less than 5 people, for example, or a small number of people in an organization. We have done one of the survey with a very small organization, and we did require them to have 100% participation in order to release that data. We take anonymity and confidentiality very, very serious. We do assure that. If, for example, you have less than 5 people in a department, I would encourage folks to collapse departments together until you have at least 10 to 20 people per department. However, we can present data for businesses as small as 20 employees. We would just redact any kind of data that would potentially identify a person from the report. Some of the data is obviously more general and we could report on that without exposing anybody's identity. Leslie has another question, which is, what are the time parameters of the quality of work-life benchmarks? Because before COVID, these surveys were administered before COVID, which could change the potentially the outcomes on a QWL survey if it was conducted now during the pandemic. Excuse me. I believe the last QWL survey was 2018, which we were able to incorporate into our data analysis. So yes, we would like to add another wave of the QWL post-pandemic. I don't believe the next one will be available until 19, 20, 21, 22, so maybe the end of this year. I'm not sure if they're planning on doing another wave this year. But, you know, I think it would be good to do some research on that. We don't, I think, in this country really use the quality of work-life data as fully as we could to look at changes in the population relative to work stress. I know Paul Landsberg, as our colleague, has published papers with another colleague on trends in job strain and other work-family conflict, for example. So there is some rich data there that can tell us a lot about changes overall in the population. Thanks, Leslie. Let's see. Chris Edmond had a question. Is the tool available overseas? He's in the UK. Yes, it can be completed anywhere. Obviously, language is a key limitation. But in an English-speaking country, it could be used. But just be aware the benchmarks that we would provide in the reports are based on US national population levels. There is another survey in Canada called Stress Assess that does look at psychosocial risks, and they have a fantastic system and report available with Canadian benchmarks. We had used that on our website previous to developing the Healthy Work Survey. And then finally, we have a questionnaire from our friend and colleague, Javier Garcia. Hi, Javier. In Mexico. He asked, how did you determine the cut points in each scale and define the levels of exposure, high, moderate, and level? And I mentioned that in the Healthy Work survey report, that we do break down the exposure for the group as well as for individuals. We are in the process of publishing a validation study. We did run psychometric reliability and factor analysis using the quality of work-life items. And based on those that were available in the quality of work-life survey, we were able to create basically tertiles of high risk, medium, intermediate risk, and low risk. And that those cut points were used in predictive analysis to see about the relationship to health outcomes. But I can make that available when it's closer to being ready. And it will be available on our website also.
So Naomi just said that the QWL will be administered this year and the data will be available 2023.
Great, and I hope that researchers out there, thank you, Naomi, that would be a great thing to look at to see changes before the pandemic compared to the 2022 data. Because I'm imagining, and we're seeing, although in some of the organizations and individuals that are using the survey, definitely seem to be higher rates of burnout, higher rates of, or exhaustion, we're using a single item, higher demands, more work-life imbalance. So it's possible, that the pandemic is having an effect on I think the pandemic is having an effect on people's work stress for sure. So are there any other questions that people have? I know our time is close. We were going to run a quick poll about what organizations are doing right now to deal with sources of stress if people are finding there are barriers. But maybe we can discuss that if people have time to stay online and ask more questions. We can wait a little bit longer and have a discussion or run a poll. So anyone interested in talking or elaborating about what their organization may be doing to address sources of work stress already? No? Okay, I'm going to run a quick poll because I'm really interested to see if people have been running a addressing sources of stress at work. So if you want to stick around and discuss this a little bit, we can, you're welcome to stay. So I'm launching the poll. The question is, has your organization ever tried to address sources of stress at work? Okay, a few more answers. Looks like we have about 63% participating. Okay, and I'll share the results. Really interesting. We have about almost 50% of people that said yes. So we'd love to hear from you if you could elaborate. I know we have some research centers here, total worker health research centers, who I'm sure may have worked with organizations to address sources of stress. These are great examples of how organizations can address stress. We have some great case studies on our website that were put together to be really accessible by Paul Landsbergis and doctoral students at SUNY Downstate. These also include not just reports of research partnerships with labor and management, but also union-led collective bargaining and collective strategies where unions have worked in partnership oftentimes with management or through the collective bargaining process to address sources of stress at work and in the contract. So there's been examples of unions that have won policy changes and have wording in the contract around reducing bullying at work, as well as reducing issues around workload. So I really highly encourage you to check out the resources that we have under Healthy Work Strategies. David mentioned that we have a CWA local that we worked with. They were one of our first, actually they were our first group to work with the Healthy Work Survey, and their investigation produced results which have led to some initial collective bargaining activity and a meeting with labor management about ways to proceed as a partnership. So labor management partnerships, we know from research, intervention research studies, are very valuable structures in organizations to allow workers to be represented along with and at the table with management. So they're kind of built-in resources, as Dr. Fagri pointed out, Paran pointed out, that using your existing resources is always really important. Anyone want to share their success in addressing sources of stress? Yes, Lena.
Hello, everyone. I will try my best because English is not my main language. I'm from Bogota, Colombia, and I'm here with my colleague Andrea Arias. We have a small company regarding mental health at work. And in Colombia, it's mandatory to apply this type of questionnaires. But unfortunately, the companies just leave their advanced, they just stay at the diagnostic phase. They just receive this type of information, but don't work towards using it for improving mental health at work. So our question is, how do you promote that they don't stay at the diagnostic stage, but go beyond that?
That is a great question, and it's one from the research community that we've been pursuing for some time. How do we turn the reality that we have all this evidence that work stress is impacting worker health, the chronic disease burden, the employee bottom line, into organizations, because in the United States we don't have requirements for organizations to attend to psychosocial risk issues or surveil for them. But then once we have companies that do want to attend to this because they recognize that it impacts not only employee health and well-being, but productivity and potentially company costs. How do we go from collecting the data, the diagnostic stage, for example, the Healthy Work Survey, to actually implementing change?
So if I may say, actually,
there's a lot of experience in this area, bringing companies along to use the tools that can create a process for interventions.
So what you can do, basically, I think you did a great job to actually do the diagnostic part, and you understand and identify the risk associated with your organization. The next step is to maybe go about and increasing employees' awareness of the issue. You can communicate with your employees related to issue that you have, and you may start from a committee that you already have. I don't know, in United States, most of the companies have health and safety committee. And you may use the health and safety committee as your first intervention team or participatory team, and have them discuss the results and try to identify the solution while they're communicating with your employees. You will be surprised how people get excited when they see that actually something is getting done. So the worst thing you can do, and actually many organizations do, is they do these surveys. They identify the problem and they sit on it and say, so what we can do about it, and they put it on the shelf. And it caused a lot of disappointment for the employees about, okay, so what? And management who said, you didn't do anything with it. So I strongly recommend that if you have those tools, start with your health and safety committee and move about what to do about it.
Thank you very much.
Thanks, Lena.
Thank you.
Anyone else have questions? Jose.
Hey everyone, my name is Jose Villaseñor. I am the wellness strategist for Irving Independent School District in Irving, Texas. We've been very fortunate this year to use a federal grant that will help us expand our wellness program to all of our employees. So what we've been able to do is hire 3 licensed professional counselors to provide professional counseling, true professional counseling to all of our employees. What we get sometimes is, well, will my boss know what I'm sharing? Will the school district know? Then we stress to them this is professional counseling. We have also been able to employ 3 wellness leads who are experts in wellness, and then will help us with presentations, creating partnerships with wellness organizations, fitness groups, nutritional groups, and financial groups also. In doing our research, I saw what you have also, what you presented is that financial stress impacts so many of our employees. So we are trying to really bring that to the forefront in a non-judgmental way, bringing in groups and programs that will help understand how to manage budgets or how to manage credit. And so that's what we're trying here. We're very fortunate. This grant will last 3 years. We're into our first year, and if depending on our success, our school district may take this on for another, take this on for another 3 years using local funds. So I just wanted to share that with you.
That's excellent.
That's
Jose, this is amazing, and I just want to recommend that having a grant in this regard is amazing, and I congratulate you. Also, it's important to collect some information about your success of your program as you're going on, either process evaluation, your impact evaluation, and this definitely helps with the integration of the program, hopefully to all the public schools, as well as sustainability of your program.
Thank you for that. Yes, we are in the process. We have purchased and brought together programs and resources for all of our employees, but we also want to ask for their input and their requests. So yes, we're right now researching how to do that. And so that's why we're here today. So this is so beneficial. What you're sharing is so important and makes so much sense, putting everything together.
And you may communicate with us if you have any questions.
Yeah, we're happy to talk and answer questions. It's a process, you know, and it's a starting point. And I think the commitment your organization has with this grant to employee well-being is very commendable.
Yes,
It's been a
absolutely.
tough year for educators, so it's even more commendable.
Exactly,
2
exactly.
years.
Thank you so much.
Thank you. Thanks for sharing. Anyone else have a question? Oh yes, Paul put a good source of information in the chat box, Jose, about ways to reduce teacher stress. It's a publication that he was, I think he was part of, that shows some really good programs and mentoring programs as well to help with teacher stress. If you check that out on the box. I'm going to run our second poll just because I think it's a really important question to ask, which is, you know, what are the major barriers that you see to implementing what we're talking about, implementing the survey, implementing workplace change or interventions? And, you know, we know that there are many barriers, and we're really trying to deal with them as researchers and with organizations in the real world. So I'm going to launch the question and see what people have, what people think, and maybe we can discuss this a little bit. Okay, I'll just wait a couple more seconds. Anyone else want to participate? Oh, I've got a couple more. Okay, we have about 70%, so I'm going to end the poll, share the results. Very interesting, as we thought. You can see here, you know, the majority of people, you know, leadership buy-in and resources, 80, 90% of people selected. Worker involvement can also be difficult because, you know, finding time for workers who are already, you know, pressed for, you know, getting their work done, especially teachers, we know have a lot of work overload. It can be hard to find that extra time to involve workers in the process, especially depending on industry. So we are aware of that as a limitation, but there are examples of ways in which workers can get involved, from the factory floor to, you know, teacher committees, trainings, that kind of thing. But leadership buy-in and resources is a big one. Baran, do you want to speak to that? Because you've had a lot of...
Actually, I am not surprised by what we get, 60% leadership involvement, because unfortunately, organizational leadership, pretty much they're trying to focus on the organization and the profit at the end of the day. However, there are very good ROI, return on investment, related to health of the employee that has been done, that shows that the effect of healthy employee on the long-term productivity and profitability of the organizations. For example, based on level of absenteeism, something we call presenteeism, where employees just come to work to just show up, but really mentally, because of the other issues, are not by their burnout, family life issues, they're not at the work, so they're not performing their tasks, and also healthcare utilizations. So I think the more we publish and we do research, and hopefully we provide this information for the leadership, and they are going to understand the importance of healthy employees. More and more large organization leadership is starting to accept this. What we have is selling this to middle managers that unfortunately they're sandwiched with the top one and the employees. And so I absolutely agree. This is a challenge that we all have and we need to work about. As far as resources, as I indicated, one of the major mistakes many people do is the immediately they try to either ask for resources or try to get resources from somewhere else when they have something already in place. You'll be surprised how you can change things around by something that's already available to you in your organization. So obviously there is for help, and hopefully in Healthy Campaign website we can put some webinar or informational pages regarding how to go about finding resources and do your intervention. But I'm not surprised to see the poor.
It is. And, I think finding existing skills among, your administration, among staff members, finding the drivers of change is really important. And I think, getting folks involved by getting influencers and drivers to be educated and interested in doing this is a really important goal to overcoming these barriers of leadership buy-in and so forth. We also do have information on our chat box that our colleague, thank you Maria, has been including links to our website. For example, we have a section on business costs with some really great statistical information about costs on to absenteeism, healthcare costs, and so forth. So does anyone else have any questions before we close? Thank you everybody for staying on, and of course we're more than willing to stay on and answer more questions, but everyone is of course free to leave. We ran over, but I think the questions have been really valuable and we appreciate it.
Thank you, everyone. Thank you for staying over time. And it was great presentation. We enjoyed doing it. And hopefully you can visit the website and the informational pages and shoot us an email if you have questions or anything.
Our email address is contact@healthywork.org, and we're here to help. So thank you, everybody.
Thank you very much.